Welcome to all. Today we are discussing about hypertensive heart disease. We know so many hypertensive heart diseases. Hypertensive heart diseases constitute functional and structural dysfunction and pathological occurring primarily in the left ventricle, the left atrium, and the coronary arteries due to chronic uncontrolled hypertension. Hypertensive heart disease is underreported to the mechanism underlying its correlates and complications and not well collaborated. Then we summarize the current understanding of hypertensive heart disease. The mechanism associated with the development of complications of hypertensive heart diseases, especially left ventricular hypertrophy, arterial fibrillation, heart failure, and coronary artery disease. We also highlight the role of dietary salt, immunity, and genetic predisposition in hypertensive heart disease pathologies. Hypertensive heart disease is a term applied to abnormalities of heart involving structure and function of left ventricle, the left atrium, and intramural coronary arteries due to sustained elevated blood pressure. Then we are going to discuss about risk factors of hypertensive heart disease. Hypertension is the most common risk factor for development of hypertensive heart disease. Additional risk factors include older age, ethnicity, being overweight, physical inactivity, excess dietary salt intake, smoking, alcohol intake, concomitant disease such as diabetes mellitus. Then all these factors contribute to an increased hemodynamic stress on the heart with chronicity. The left ventricle of the heart hypertrophies to compensate the load, but in the long run, this can lead to heart failure. Obesity is an important risk factor for development of hypertensive heart disease. It is associated increase in renin secretion that is mediated by leptin production, adipose cells, resulting in blood pressure elevation and exacerbating already existing hypertension. Moreover, obesity-related increasing in sympathetic tone counteracts and body's compensatory mechanism for the abnormally elevated renin and aldosterone level and induce cardiac fibrosis and endothelial dysfunction and contribute to the development and complications of hypertensive heart disease. Effect of chronic hemodynamic stress on the heart. Chronic hypertension resulting from various stimuli leads to left ventricular hypertrophy as a compensation for the hemodynamic stress and metabolic demand on the heart. However, heart failure results when the heart can no longer withstand the persistent hemodynamic stress, BP, blood pressure. Then mechanisms of hypertensive heart disease and its complications. The common complication of hypertensive heart disease is either diastolic heart failure, systolic failure, or a combination of two. And individuals with hypertensive heart disease have a higher risk for the development of arterial fibrillation, perioperatic ischemia, coronary artery disease, kidney disease, heart and heart valve diseases, aortic dissection, intramural hematoma, and aortic ulcer. Left ventricular hypertrophy mechanism in hypertensive heart disease. Left ventricular hypertrophy mechanism in hypertensive heart disease, that is LVH, is a early compensatory response to hemodynamic overload in chronic hypertension. LVH can predispose to cardiovascular events in individuals with hypertension who have coronary artery calcifications, but within symptoms are individuals with hypertension independent of treatment and other existing cardiovascular risk factors. Several proteins, mediators, and cellular responses such as angiotensin. Second, cardiac myosin binding protein C, endothelin 1, S thiolated protein, norepinephrine, RHO and RAS protein, thiolase, oxidative stress, heart shock protein. The enzymatic cleavage of angiotensin by renin converts angiotensinogen to angiotensin 1 and then angiotensin covering enzyme converts angiotensin 1 to angiotensin 2. Angiotensin 2 is the main effector molecule of renin angiotensin aldosterone system that serves to control blood pressure. Angiotensin 2 increase blood pressure by including water and sodium reabsorption, including vasoconstriction and exerting proliferative, pro-inflammatory and pro-fibrotic activities by binding to angiotensin type 1 and type 2 receptors. Then angiotensin 2 formation and efforts on blood pressure. Angiotensinogen is produced by the liver and converted to angiotensin 1 by the action of renin produced by the cells of the kidney. Angiotensin 1 is then converted to angiotensin 2, angiotensin converting enzyme. Angiotensin 2 binds its receptors to induce several activities such as inflammation, vasoconstriction, oxidative stress, and reabsorption of water and sodium, leading to elevated blood pressure and hypertension. That is MAS and marked assisted selected. Then angiotensin to increase blood pressure and includes pathological features characteristics of hypertensive heart diseases by activating angiotensin 2 receptors, regulating cardiac contractility, cardiac remodeling, growth, inflammation, apoptosis, and impulse propagation. Angiotensin 2 activates extracellular signal regulated kinase, mitogen activated protein kinase pathways. Another mechanism associated with LVH is activation of calcineurin and calmodulin kinase 2 due to the exchanged sensitivity to calcium resulting the calcineurin binding to the dephosphorylating nuclear factor of activated T cells. Thus, this steps increases hypotrophic gene expression through mechanisms that are not yet clear. Integrins have also been implicated in LVH mediated by RAAS and MAPKS. The next one, mechanisms of heart failure associated with hypertensive heart disease. LVH progresses to heart failure with the compensatory mechanism have failed to meet the functional LVH progresses to heart failure when the compensatory mechanism and metabolic demands of the myocardium. Heart failure is the progressive clinical syndrome characterized by reducing ability of heart to pump blood to meet the body's metabolic demand. Symptoms include failure, fatigue, peripheral edema, and distended jugular veins. The symptoms or signs are caused by abnormality in cardiac function and structure, and the clinical syndrome is caused by the increase in natriuretic peptide levels of pulmonary or systematic congestion. Heart failure can either be acute or chronic. Then, clinical stages of heart failure, blood on symptoms according AHA, ACC, HFSA guidelines. First one, stage A, patients at risk for heart failure but without current or prior symptoms or signs of heart failure and without structural or biomarker evidence of the heart disease. Then stage B, pre-heart failure stage for patient without current or prior symptoms or signs of heart failure but have evidence of structural heart diseases or abdominal cardiac functions or elevated natriuretic peptide levels. Stage 3, for patients with current or prior symptoms and signs of heart failure caused by structural or functional cardiac abnormality. Then stage D, advanced heart failure for patients with severe symptoms or signs of HF, addressed recurrent hospitalization despite guidelines directed medical therapy, refractory or intolerant. Then last stage, GDMT requiring advanced therapies such as consideration or transplant, mechanical circulatory support and palliative care. ACC, American College of Cardiology. AHA, American Heart Association. HFSA, Heart Failure Society of America. The transition from hypertrophy of hydrogen leads in the hypertensive heart diseases is divided by several cellular meditation tests, many of what are progressive change already explained under LVH and include oxidant stress, apoptosis, insufficient angiogenesis, mitochondria dysfunction, metabolic rearrangements, and fetal gene program induction. The next one, mechanism of conduction arrhythmias association with hypertensive heart disease. Then mechanism of conduction arrhythmias associated with hypertensive heart disease. The most common manifestation or complications of hypertensive heart disease is cardiac arrhythmias, and the most common among these, a regular and irregular and very rapid heart rhythm associated with the increased risk for blood clots on the heart, stroke and heart failure. Detected during the normal heart conduction, electrical signals from the sinoatrial node travel through the atria to the atrioventricular node, passes through the ventricles, causes them to contract. The electrical signals conduct in the cyclic manner, firing from multiple locations, leading to the faster and irregular heartbeats and characterized by lack of P wave and irregular QRS complexes and ECG. Electrocardiography and conduction system of the heart, normal electrocardiography, conduction system of the heart, C, arterial fibrillation, ECG tracing. Although effective control of blood pressure prevents some antihypertensive drugs such as thiazide, diuretics used to control blood pressure can contribute to risk by inducing hypokalemia and hypomagnesemia. The mechanism associated with clear and include modulation of L-type calcium 2+ and K+ current and gap junction function, cardiac structural remodeling and automatic remodeling with an characterized by altered symptovagal activity and hyperintervention. One explanation for the chaotic rhythm is the structural remodeling characterized by arterial fibrosis occurring in hypertensive heart disease is associated with the recentry of the self-sustaining cardiac rhythm abnormality. Ectopic conduction activities originating from the pulmonary veins is one of the common triggers due to the specific action potential properties of the pulmonary vein. Cardiomyocytes. Mechanism of coronary artery diseases associated with hypertensive heart disease. Coronary artery disease in hypertensive heart disease is accelerated by chronic elevation of blood pressure that includes endothelial dysfunction and exacerbates atherosclerotic processes. LVH exacerbates coronary artery disease by promoting myocardial ischemia mediated by decreased coronary reversed and increased myocardial oxygen demand. Atherosclerosis remains the main cause of cardiovascular diseases, and hypertensive heart diseases accelerates complication of atherosclerotic disease. Coronary arteries are considered the most susceptible blood vessels to atherosclerosis in the entire cardiovascular system due to the structurally high curvature and torsion that plays a role in localization of early coronary artery thickening. Blood pressure disturbances and irregularities and cardiac remodeling associated with hypertensive heart disease increase the risk of coronary artery diseases and related complications such as myocardial infarction, angina, heart failure. The risk factor for coronary artery diseases are similar with those associated with hypertension. Sex differences in burden, pathogenesis, or severity of coronary artery disease do exist. For example, incidental finding of coronary microvascular dysfunction is more common in women than men. In addition, coronary microvascular dysfunction occurs more in women than men. Atherosclerosis progression in coronary artery disease. Coronary artery disease is caused by narrowed coronary arteries due to advanced atherosclerotic fatty plaque. Atherosclerosis is coronary artery disease and complications is initiated by fatty streak and macrophage infiltration to rid of cholesterol deposit in the coronary arteries. Macrophages that have engulfed cholesterol deposits transform into lipid laden foam cells, enter the subendothelial layer and also actuate the immune system, leading to the inflammation. Increased deposition of fat. Calcium and persistent inflammation leads to formation of fibrotic and calcic changes that can result in the plate rupture, thrombosis and blockage of blood flow in the vascularity. The resulting complications of advanced atherosclerotic lesions include myocardial infarction, arterial fibrillation and left ventricular hypertrophy, among others. Activated macrophages and T cells are the main players. The mechanisms underlying the pathophysiology of coronary artery disease include fatty streak formation that activate macrophages to take up of the lipids and deposit in the subendothelium. Immune cells includes T cells are activated and recruited, secreting inflammatory cytokines in the progress and results in the reposition of oxidized low density lipoprotein particles and collagen to form a stable subendothelial plaque that grows with time. Coronary artery is a common type of heart disease. It affects the main blood vessels that supply of blood to the heart, called coronary arteries. In CAD, there is induced blood flow to the heart muscles. A buildup of fats, cholesterol, and other substances in and on the artery walls, a condition called atherosclerosis, usually caused coronary artery disease. The building up called plaque makes the arteries narrow. Coronary artery disease often develop over many years. Symptoms and from the lack of blood flow to the heart. They may include chest pain and shortness of breath. A complete blockage of heart blood flow can cause a heart attack. Treatment for coronary artery diseases may include medicines and surgery, eating a nutritious diet, getting regular exercise and not smoking can help prevent coronary artery disease and conditions that can cause it. Coronary artery disease also may be called coronary heart disease. What is coronary artery disease? A Mayo Clinic cardiologist explains. Symptoms. Symptoms of coronary artery disease happen when the heart doesn't get enough oxygen-rich blood. Coronary artery disease symptoms may include chest pain called angina. You may feel accusing pressure, heaviness, tightness, or pain in the chest. It may feel like somebody is standing on your chest. The chest pain usually affects the middle or left side of the chest. Activity or strong emotions can trigger angina. There are different types of angina. The type depend upon the cause and whether rest or medicine makes symptoms better. In some people, especially women, the pain may be brief or sharp and felt in the neck, arm, or back. Then, shortness of breath. You may feel like you cannot catch your breath. Fatigue. If the heart cannot pump enough blood to meet your body's need, you feel unusually tired. Symptoms of coronary artery disease may not be noticed at first. Sometimes symptoms only happen when the heart is beating hard, such as during exercise. As the coronary arteries continue to narrow, symptoms can get more severe or frequent. A completely blocked coronary artery will cause a heart attack. Common heart attack symptoms include chest pain that may feel like pressure, tightness, squeezing, and arch. Pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes the upper belly. Cold sweats, fatigue, heartburn, nausea, shortness of breath. Next, lightheadedness or sudden dizziness. Chest pain is usually the most common symptom of heart attack. But for some people, such as women, the elderly, and those with diabetes, symptoms may seem unrelated to the heart attack. For example, they may have nausea or very high brief pain in the neck or back. Some people having a heart attack don't notice symptoms. When to see a doctor, if you think you are having a heart attack, immediately call 911 or your local emergency number. If you don't have access to emergency medical service, have sometimes drive you to a nearest hospital. Drive yourself only as a last option. Smoking or having high blood pressure, high cholesterol, diabetes, obesity, or the strong family history of heart disease make you more likely to coronary artery disease. If you are at high risk of coronary artery disease, take your healthcare professional. You may need tests to check for narrowed arteries and coronary artery disease. Angina pectoris symptoms, types, causes, and treatment and prevention. Angina, which is the most common symptom of ischemic heart disease, is chest pain or discomfort that occurs due to the reduced blood pressure to heart muscles. Ischemic chest pain occurs when one or more of the coronary arteries get narrowed. It is one of the major causes of morbidity and mortality worldwide. Chest pain may be due to non-cardiac and cardiac causes. Stable angina, unstable angina, microvascular angina, and vasospastic and variant angina are the 4 different types of angines. The treatment of angina is aimed at managing symptoms and preventing the progression of cardiac events. Management is multifactorial and requires a few lifestyle modifications to prevent further complications. Angina pectoris meaning. The term angina pectoris is derived from the Latin ange and meaning to strange, and pectoris means chest. Together it means straggling feeling in the chest. Angina is one of the most common symptoms of ischemic heart disease. Symptoms of angina are seen in approximately 90 lakhs of patients in the US. Prevalence of angina increases with the age of both men and women. In Western countries, stable angina affects approximately 30,000 to 40,000 people per 10 lakhs people. The estimated prevalence for women and men aged 45 to 64 years are 4 to 7 percentage and 5 to 7 percentage respectively. In men and women aged 65 to 84 years, prevalence is 14 to 15 percentage and 10 to 12 percentage respectively. As per the Clarify study, which is the international perspective observational longitudinal cohort study in the stable coronary artery disease outpatients, the prevalence of angina in India decreases from 27.8 percentage to 11.2 percentage over 5-year period. From recent studies, it is estimated the proportion of symptoms-based angina in 4.69 in the older males and 7.02 in the older males. Then types of angina pectoris. Angina is not a disease itself, but it is the symptom of underlying condition. Usually coronary artery. There are 5 main types of anginas, which include stable angina, unstable angina, microvascular, vasculopathic, and variant angina, and refractory angina. Based on the type of angina, many factors can trigger pain. The 5 types of anginas are described below. First one, stable angina. Also called stable angina, is the chest pain that occurs due to the interrupted blood supply to our muscles because of narrowing of coronary artery. It usually causes uncomfortable pressure, fullness, sneezing, and pain in the center of the chest. Unstable angina. It is one of the several acute coronary symptoms that causes while resting causes unexpected chest pain. It does not go away with rest and should be treated as an emergency, as they may be a sign of heart attack and can even lead to a cardiac arrest. Variant angina. It is also called Prinzmetal metal angina. It does not occur the physical excitation or emotional stress. The pain is very painful and occurs when the individual is resting, usually between midnight and early morning. Then microvascular angina. This type of angina is usually symptoms of coronary microvascular diseases, which is heart disease affecting the smallest coronary artery blood vessels. Refractory angina. It is a chronic and persists from the angina that occurs when the heart demand for oxygen exceeds its supply despite optimal medicinal therapy. It is caused by frequent episodes of chest pain and cannot be controlled adequately by medicines and revascularization therapy. Angina pectoris symptoms. Symptoms of angina vary based on the type and they may differ in severity, location, timing, and degree of relief. The primary symptoms of angina is the chest pain or discomfort. The pain in angina can feel like pressure, tightness, discomfort, seizing, heaviness, and burning sensation of the chest. The common symptoms of angina include shortness of breath, extreme fatigue, fainting or lightheadedness, heartburn, weakness, sweating. Stable angina symptoms. The pain in stable angina occurs usually during physical exertion, lasts for short period. Pain can relieved by taking rest and use of medications. The pain feel like the gas or indigestion. It may feel like the pain in spreading to the arms and the back. Unstable angina symptoms. The pain in unstable angina usually occurs during physical exertion or while resting or sleeping. It can be sudden, last longer than stable angina, does not get relief by rest or medicines, worsens over time. It can be lead to heart attack. Wherein the angina symptoms, the pain develops while resulting usually between midnight or early morning. It's severe, gets relieved with the use of medications. Microvascular angina symptoms, the pain, the more severe and lasts longer than all the other type of anginas. Accompanies shortness of breath. It is first noticed with the routine physical activities. Refractory angina symptoms. The pain is severe and symptoms last for more than 3 months. Pain cannot be managed with medicines or other treatments. Angina symptoms in women. Symptoms of angina can be different in men and women. Women can feel pain in the areas from the sources of pain such as arms, necks, backs, and jaw. They may also present symptoms like shortness of breath and lightheadedness. Angina pectoris cause. Chest pain can occur the non-cardiac causes, non-ischemic causes, and due to ischemic causes. The non-cardiac causes of chest pain include lung disease, then panic attacks. Pericardial diseases is a non-ischemic cause of chest pain. Atherosclerosis of coronary arteries and coronary vasospasm is the cardiac ischemic causes of angina. Then angina causes. Angina is not a disease but a symptom of underlying heart condition. Coronary artery disease, which is a medicinal cardiac condition, can cause angina. This type of angina depends on the condition causes and following the types of angina and the causes. Stable angina causes This type of chest pain occurs when the heart muscles do not sufficient